SSM St. Mary's on. Hopefully she'll join us in a few minutes. But I think we'll go ahead and get started. Welcome, I'm Christy Campbell from the Cole County Health Department, and we've been doing these weekly briefings. I think it's a really good time for us to get together and share what's going on with COVID in our community. Here at the Health Department, we're cautiously optimistic about what we have been seeing with the data. Our recent case numbers have been lower than the previous months, along with the positivity rate, and I think that is very positive news, and we hope it continues. We've also been hearing some better news from the hospital that we are also cautiously optimistic about. I'm sure Dr. Haight, Dr. Adams will share the good news there. Like I said, we really want to thank everyone for listening, and it seems that people are following the guidance that we put out in the advisory. We're glad to hear that, and we want them to continue to do all those preventative measures that we have been talking about and continue to boost their immune system, and including things like getting their flu shot. So like I said, we're cautiously optimistic about the positive things that we have been seeing lately. So we're going to go ahead and get started this afternoon. Sorry, Chesney Schulte from our staff is going to talk about those CDC quarantine guidelines that changed last week, just as a reminder and to brush up on those. So I'll turn it over to Chesney. Oh, Chesney, you're on mute, I think. We can't hear you. So we'll have Dr. Sullivan go ahead and go, and then we'll give Chesney a time. She can get to another computer to be able to speak. So go ahead, Dr. Sullivan.
Okay, thanks. I thought it would be helpful to talk a little bit about who we would consider to be at increased risk for developing severe illness from COVID-19. So severe illness is defined as anyone who may require hospitalization, ICU care, a ventilator to help them breathe, or someone that may die from COVID-19. And as many of you have heard, the risk for severe illness increases with age. So older adults are at the highest risk. But according to the CDC, there are also certain underlying medical conditions that would make a person be at increased risk. And so these include cancer, chronic kidney disease, chronic lung disease such as COPD, heart conditions, obesity, in particular a BMI over 40, pregnancy, sickle cell disease, smoking, diabetes, and those that have a weakened immune system, such as those undergoing cancer treatment or those that have experienced a prolonged use of corticosteroids or other immune weakening medications. And so if you have any of these underlying medical conditions or you're at risk for developing severe illness from COVID-19, it's important that you take all the necessary precautions that we've spoken about over the last several months and are included in the city and county advisory to help protect yourself. Thanks.
Thank you, Dr. Sullivan. Dr. Haight from Cap Region Medical Center.
Hello, everyone. As Christy mentioned earlier, the number of cases that we're having within Cole County and many of our surrounding counties has decreased. And so our positive or recent positive cases have gone down. In addition, I know Dr. Adams is on and she can speak for St. Mary's, but I do know both of our hospital COVID volumes have also gone down, which is very good. And I want to thank everyone who has heeded the message from the city and the county, especially during this time that we're used to getting together all of the time, by choosing to follow when they do get together in smaller groups of people and people that they are usually associated with, and choosing to physically distance from one another. In addition, the hand washing, the proper quarantining, and the masking when you're out and about, all have been very beneficial for our community. And so it puts much less stress on our hospital staffs that are taking care of these patients who can become very, very ill. So again, we want to thank everyone for contributing, and we hope that you will continue to do so as we enter the Christmas and New Year's time. Again, times that we're used to getting together as families, choosing to instead Zoom or do some other virtual type visiting instead of coming together and all meeting in a large group together. Thank you.
Thank you, Dr. Haight. Dr. Adams from SSN St. Mary's.
Hi, thanks for having me again. Want to echo what the other physicians on the call have already said. Please continue to practice the safety behaviors that you have been doing so far. Any flattening in the curve that we've seen so far with COVID in our community, we have to give all the credit to you. Your behavior changes and your choices on whether or not you are going to expose yourself or others to possibly transmitting viruses between each other. You are the reason that we have seen a flattening of the curve. So keep up the good work. Now is not the time to change those safe behaviors. We're coming into Christmas and New Year's, and I know it's going to be a difficult decision for many people, but I know many of you have already made the difficult decision, so please keep doing that. As you know from the media, the Pfizer vaccine was an FDA hearing yesterday, and that went pretty well. The final emergency use authorization is expected to be given tomorrow if all goes as planned. So Pfizer has this ongoing study of about 44,000 patients that's in phase 3. And they have seen very good efficacy across all age groups that were studied, across races and ethnicities, and across a myriad of comorbid illnesses. So no major unexpected safety issues that came up, although I know there has been some concerns that the drug was not studied in pregnancy. It was not studied in children under the age of 16. And there is some concern for folks who have strong allergic reactions, but more research is needed in this area before any recommendations can be made. So we're in a phase 3. There's only been a few months worth of data. So we really just need more information in order to give recommendations that are founded in science. So we will start vaccinating our frontline patient-facing healthcare workers next week. We expect that the allocation of vaccine that's coming to Missouri, we're going to get about 10% of that allocation into our region, and we have plans underway to begin vaccinating patient-facing healthcare workers next week. So please keep us in your prayers. This is a very large undertaking, requiring a lot of coordination through the communities, and we'll come back to you later with more updates on how that's going. Thank you.
Thank you, Dr. Adams. Chesney, we'll circle back to you and see if you want to give us that update on those CDC quarantine guidelines.
Yes, thank you. Can you hear me now?
We can.
Okay. So I just wanted to take this opportunity to talk about the December 2nd update from CDC. We talked about it on the last call, but just wanted to provide a reminder. That guidance is that people who have had close contact with a positive case that remain symptom-free can end their quarantine on day 10 or on day 7 after receiving a negative test result. After stopping quarantine, people should continue watching for symptoms until 14 days after exposure and practice preventative measures. Those include washing their hands often, avoiding close contact, covering their mouths and nose with a mask, clean and disinfect commonly used surfaces. If symptoms develop at any time in that period, they should immediately self-isolate and contact their healthcare provider. Whole County Health Department supports this new CDC guidance, but I encourage you to talk with your school administrators, employers, etc., about how they might be adopting those protocols that CDC has recommended, and just see what that might mean for you.
Thank you, Chesney. Presiding Commissioner Sam Bushman, do you have any words that you would like to share with us today?
Well, I mean, nothing has really changed. I've been out, finally started my Christmas shopping, so I've been shopping here uptown. And see, we require a mask in our store. We ask customers to wear them. We wear masks. But I went to Carrie's twice. They require a mask. American Shoe requires mask. Downtown Book and Toy, the restaurants and the stores we go to, people are masking. So I think, I think our advisory is working really very well. I was getting the news on Audrain County, who just now enacted a health advisory, and they are asking their businesses to sign a letter of intent or cooperation, and having them sign saying we support it too. So that might be something we want to do through the chamber. But I think people are getting used to wearing masks when they do shop and when they go out to eat. So I'm always the optimist, but again, since our numbers seem to be declining, I'm going to stay optimistic.
Me too. Thanks, Sam. So today we have Mayor Pro Tem Carlos Graham with us. Carlos, would you like to share something from the city perspective?
Absolutely. First of all, good afternoon, everyone. Thanks for allowing me to be here today. Mayor Turgeon has a conflict today, so she asked that I share this. This is in quote. As we approach the usual holiday party season, I'm hoping that people will rethink their plans. It doesn't mean cancel, but rather get creative, end quote. As a business owner, her store Christmas party tradition has been going to Eris with employees and their families. Instead, this year, she will order Eris pizza for each staff member to go, and they'll do a Zoom Christmas party while still supporting local businesses. You can still celebrate distance, perhaps ordering a lunch for employees at their cubicles and having a virtual party during that lunch rather than in person. Space out and celebrate safe. Spread joy, not the virus. And like the mayor always do during this time, she reads those 6 bullet points in which Cole County and the city of Jefferson put together. And one is to stay at home if you're sick. Number 2, physical distance from others outside of your household. Number 3, limit gatherings to a number of physical distances that can occur. Avoid gatherings where physical distance cannot be maintained. Wear a mask if you cannot physical distance or avoid gatherings. Encourage telecommuting and physical distancing within office buildings. And the last, offer low contact shopping methods, including curbside and delivery, and increase distance between seating and restaurants. And I personally want to reiterate what others on this Zoom meeting has said, and also say that this virus is very serious. I'm asking everyone to please, if you can, wear a mask. Wear a mask. Wearing a mask is not a political statement. This virus doesn't care your color. This virus does not care about your political affiliation. This virus is very serious. As leaders on this Zoom call, and we're all leaders, whether we're elected officials or we're healthcare officials, we all have a part to do, and that's to help educate our constituents, to tell them the truth about this virus. I was watching the news last night, and I got a heavy heart. And I try to stay away from the internet, but last night I was watching the news, and it was a sit-down interview by a pastor in Tennessee. And during this interview, this pastor, who had several hundred people at his church, was telling individuals that we are not in a pandemic. And he also said that COVID-19 is a hoax. And that was very concerning to me, because as I look around and I look at the news and I see that today we have over 293,000 people that have died, have lost their lives, and still counting. So I just want to reiterate to everyone, as leaders, to educate, push forward the truth that this virus is very serious. We all want to get past this. We really do. We want to return back to some type of normalcy in our lives. I want to do the same thing. But for me, wearing this mask is very important. I take this mask as if when I get into my car and I put that seatbelt on, and I'm just saying that I'm here to make sure that I'm able to live it, to get back home to my family. By wearing that seatbelt, hope it's going to protect me from an accident. So when you buckling up, I'm asking you to mask up. It's just that simple. No one wants government telling them what to do. I understand that. And it sounds like that we're doing the right thing here in our community. Please, ma'am, please, sir, I'm begging you, wear a mask. When our military men and women go on the battlefield, they're not taking rocks. They're taking ammunition. And for now, for this battle that we're in right now, this mask is part of our ammunition. And I'm encouraging everyone to wear a mask. And with that, I want to say that, whether it's political correct or not, I want to say, God bless this world. God bless this nation. God bless our state. And most of all, God bless the city of Jefferson. Thank you.
Thank you, Carlos. We have really been trying to emphasize all the public health interventions that do help spread the virus. We know that, social distancing is the most important. Masks are very important. Washing your hands, sanitizing those frequently used surfaces. It's really all the things that everyone can do to protect themselves. And, we have been seeing increases throughout the nation in areas that have mandates and areas that don't have mandates. It really does seem like the virus is affecting everyone. So at this time, I'd like to open up for other comments or questions. I see that our chief of EMS is on today. I don't know if he has any comments that he would like to offer, but at this time, we would entertain any other comments or questions. So Chief Linderworth, did you want to say something?
Good afternoon, everyone. So I just wanted to give a quick update on the status of emergency medical services here in Cole County. So last month, we ran 1,107 calls, which is an increase of 18% from the year previous in November. So that's a marked increase in that. Currently, we're on pace to run approximately 976 calls, which is a 14.55% increase from last December. A majority of those increases are directly related to COVID, and we're also having to do much greater distance of movement of patients. So I ask anyone that does not have a true medical emergency to consider calling your doctor first prior to calling 911. And also, if you do have a life-threatening emergency, obviously please call 911 and we'll get you to the closest appropriate facility. The news that the hospitals are not as inundated with patients, especially those experiencing COVID symptoms, is good to hear. And we hope that our system will be less stressed because of that. Unfortunately, right now, that increase of nearly 15% is creating a stress within our system. We are currently operationalizing plans to put a quick response triage vehicle in place. On low acuity calls, that vehicle will show up and assess patients to determine their medical necessity for emergency treatment. If it is determined through the direction of our medical director through protocols that is not a patient that needs immediate emergency care, we will not transport that patient and assist in finding alternative treatment avenues for that patient. If the patient has priority symptoms, we will obviously transport them and an ambulance will be called for that. Anything that comes in as determined as a high priority call will immediately have an ambulance dispatch. That probably will go into effect sometime later next week to help alleviate some of the stress on the system as it currently stands. That's all I have. Thank you.
Thank you, Chief, and thank you for joining us today. Are there any other questions or comments from the group? Okay, hearing none, then I guess we're finished for today. Again, thank you for joining us, and everyone have a safe and happy weekend. Bye-bye.
You too.